Patrick Hutzel from intensivecarehotline.com with another quick tip for families in intensive care. So today's tip is a question that I had from a reader who says, my mom is in ICU, she's on a ventilator, the ICU team wants to do a tracheostomy. Does a tracheostomy affect the brain? What a great question. And again, it illustrates to me that the biggest challenge for families in intensive care is simply that they don't know what they don't know. They don't know what to look for. They don't know what questions to ask. They don't know their rights, and they don't know how to manage doctors and nurses in intensive care. And this question is further illustrating that. Let me explain this to you. So whilst the tracheostomy does not impact on the brain as such, it impacts on the brain indirectly, and here is why. When someone is in intensive care on a ventilator with a breathing tube, most of the time they are in an induced coma. They are on sedation, such as propofol, Versed, or midazolam, or sometimes Presidex, and they're often on opiates such as morphine or fentanyl, because intubation is very painful and uncomfortable. So when someone is in an induced coma, that is impacting on the brain because, someone is more or less asleep all the time, induced by medications. One of the main purposes of a tracheostomy is to wake someone up from an induced coma, assuming they can't come off the ventilator, which is why a tracheostomy is often done in the first place. So once a tracheostomy has been done, in most cases, you can stop sedation and opiates very quickly. So then a patient can wake up and be awake, and hopefully the brain is functioning. That's assuming there are no other neurological issues, such as that a patient, God forbid, had a stroke or seizures while they were in an induced coma. So therefore, a tracheostomy does impact on the brain because it gives the patient the ability to wake up from an induced coma in most cases. So the question is definitely relevant, and that's how it's being answered. Yes, it does impact on the brain because sedation and opiates can be switched off and a patient can wake up and work their way towards weaning off the ventilator in many cases. I hope that explains and answers your question. Now, we have a membership for families of critically ill patients in intensive care at intensivecarehotline.com. If you go to our membership link, and you can get access to the membership there, or if you go to intensivecaresupport.org directly. In the membership, you have access to me and my team 24 hours a day in the membership area and via email, and we answer all questions intensive care related. I also offer one-on-one consulting and advocacy for families in intensive care over the phone, Skype, Zoom, email. And I talk to you and your families directly, and I advise you, I strategize with you, and I talk to doctors and nurses directly. I have worked in intensive care for over 20 years in 3 different countries, where I also worked as a nurse manager for over 5 years in intensive care. I have been consulting and advocating for families in intensive care for over 10 years here at intensivecarehotline.com all around the world. Have a look at our testimonial section and at our podcast section, where you get all the feedback from our clients as well. We have saved lives over the years, I can say that without any exaggeration, by advocating for families in intensive care. When I talk to doctors and nurses directly, I ask all the questions you haven't even considered asking, and you will see that when I talk to them, you get a lot more information than you ever thought was possible. Once again, because I know what to look for, I know what to ask, and I know how to get information from them that you are not able to get because you don't have all the clinical insights that only someone gets who has worked in intensive care for so long. Now, I also represent you in family meetings with intensive care teams. Again, I strategize with you, A, whether you should go into a family meeting, and B, if you do go, what do you say? When do you retreat? Should you even go in a family meeting with intensive care teams in the first place? most families in intensive care have no idea what to do. They have no idea that it's even an option not to go into a family meeting. They have no idea what to say, what questions to ask in a family meeting. It's critical that you have representation from someone who understands intensive care inside out. We also offer medical record reviews in real time so that you can get a second opinion in real time. We also offer medical record reviews after intensive care if you have unanswered questions, if you need closure, or if you are simply suspecting medical negligence. And all of that you get at intensivecarehotline.com. Call us on one of the numbers on the top of our website, or simply send us an email to support@intensivecarehotline.com. If you like my videos, subscribe to my YouTube channel for regular updates for families in intensive care. Click the like button, click the notification bell, share the video with your friends and families, and comment below what you want to see next or what questions and insights you have. Thanks for watching. This is Patrick Hutzel from intensivecarehotline.com, and I will talk to you in a few days. Take care for now.